So my name is Resham. I'm speaking to you here from London. Thank you so much for joining us today. I'm a policy and strategy specialist, and I am delighted to be here today at the ABLF, and we'll be moderating 2 back-to-back sessions here. This first session features 2 leaders who subscribe fully to the narrative of the future being tech-led, and I'm really excited for you to hear from them. If you could post on social media with the hashtag ABLFcity, that would be absolutely fantastic so people can follow the conversation. This session will be talking about the crisis, a catalyst for a tech-led future. As the times have presented great devastation, proactive leaders around the world are finding solutions aided by digitization. Playing a crucial role, and our 2 brilliant speakers today will be sharing their thoughts and insights with us. So I'm delighted to announce our 2 speakers. We have His Excellency Khalfan Belhoul, the CEO of Dubai Future Foundation. He serves as the CEO, and it was launched by His Highness Sheikh Mohammed bin Rashid Al Maktoum to play a pivotal role in shaping the future of Dubai. Joining His Excellency is Dr Preetha Reddy, the Vice Chairperson of Apollo Hospitals in India. It's one of Asia's foremost integrated healthcare providers, established in 1983, and she's widely recognized for her contributions in advancing medical care to millions around the world. So we have 2 brilliant speakers, and what we're going to start by asking, and I'll go to His Excellency first, is with the world being forced to adopt digital transformation across almost every sector, how has this benefited the government and the private sector and supported continuity in business?
Thank you very much. Bismillah ar-Rahman ar-Rahim. First of all, thank you for the warm introduction. I'd like to thank His Highness Sheikh Nahyan bin Mubarak Al Nahyan, Cabinet Member and Minister of Tolerance and Coexistence, for inviting us to this session. Honored to be with you, honored to be with Dr. Reddy on the session, and also honored to be a part of an esteemed list of speakers, their excellencies, and esteemed other speakers that have joined us today. I was part of this event since it started, and enjoyed this new platform as well. That's honestly part of this digitization and how things have changed. A pretty unique software here. It gave us a feeling that we're really actually in a physical event where you're actually roaming around different rooms and different areas, and it's a sign of how digitization and adaptation to the current situations is really an opportunity. And to that also, please allow me to wish you all to be in the best of health and safety in those challenging times, which inshallah will be jointly passing by in the soonest time possible. I think mentioning the government's role in those current times and what opportunity a government can actually get from what's happening, I think is a very broad question, and depends on what type of government we're dealing with. I think in those current situations, not every government will actually flourish from this situation. It's the agile governments that are going to take the opportunity from what's happening. Obviously, the global pandemic, and this is something that's been repeated so many times, it has accelerated things. Yes, it did, but I think the opportunity that governments have are the governments that are agile, and they are the ones that are willing to accept change. And when I say change, it means adapting in every way and form when it comes to regulations. And you've heard His Excellency Abdullah Mantog, the Minister of Economy, who also ironically led the Dubai Future Foundation, who I have personally worked with a lot in many initiatives and learned from him a lot in many of the projects that the Dubai Future Foundation has actually launched. We've jointly worked on many of those initiatives, and I think he mentioned in his session how important it is for us to be agile and for us to be adaptive. So I think it's an opportunity for governments, but it's an opportunity for agile governments to actually, if you're not as agile, you will not take the opportunity or actually leverage on the success stories that can come out from this challenging period. And you talk about, like I said, regulation amendments, supporting mechanisms, acceptance of risk that comes with new ideas from different initiatives that can come due to the pandemic, whether it's exploring new technologies in 3D printing, whether it's accepting blockchain transactions for tracing. So you need this agility, and I think we're blessed in Dubai and in the UAE to have the mindset of an entrepreneur that comes all the way from our leaders in the United Arab Emirates. And that's what is the success story of the United Arab Emirates. We look at the country, a country that was highly dependable on pearl trading in such a short period of time. With the discovery of oil, then there was high dependency on oil. With the diversification and openness and tourism and financial hubs and becoming more inclusive and accepting of new ideas, we, walillah alhamd, and have reached to where we are at the moment as a nation. But this required a lot of risk-taking, a lot of agility, and a lot of acceptance. So in summary, I think a continuation of that government agility is the best recipe of success to really reap the benefits if there are in challenging times.
Excellency, that's absolutely fascinating in terms of insights. And Dr. Reddy, we've heard a lot about agility, but what are your views in addition to agility? What other factors are needed or are essential to leverage digital health so that we could predict, prevent, and manage future health crises and hopefully avoid the global pandemic we've suffered this year?
For the invitation and your excellency, it's good being in a conversation with you, and for all the wonderful participants, a warm wish from India. We're really looking at very disruptive times, and I do want to quote Sir Winston Churchill here, and he says, "Never let a good crisis go to waste." So I think in the crisis has evolved, especially in the healthcare sector, digital access to many people who actually didn't even have access to healthcare. And I think that has changed, and it's changed forever. We've seen adoption of telemedicine, which it's gone up by 300% in a country like ours. I know in the US that now even the insurers love it so much, because it's cut the cost dramatically and it's given people access to all their at least basic healthcare needs, which has saved tons and tons of dollars. So I think telemedicine has been one transformational happening with digitization. But with that has come, multiple, I don't want to say opportunity as such in a crisis, but learnings in a crisis which will actually lead to better outcomes. And in that, just like, education went from the classrooms to the living rooms overnight, and societies got disrupted, healthcare, I think, got completely disrupted. Patients really don't want to come into hospitals if they can help it. So the point of care has moved from hospitals to people's homes, from people's homes to actually their palms, because a lot of it now depends on how they utilize technology, which is available completely in their hands. So from being a doctor-driven, institution-driven decision-making, it's now decision-making by the owner of the problem. And I think, so we've given people more choices, we've given people more access, we've given people a methodology to be in charge of their lives. So what I foresee is that, while the pandemic is not going to just go away tomorrow, we're not going to wake up tomorrow and say, okay, fine, the sun is shining brightly and COVID has gone away. But we will in the future see how we can cope. So I think we've learned some incredible lessons. We've also learned through digitization to cut unnecessary interventions, to cut waste, to cut unnecessary diagnostics. So I think the level of care has actually become, more comprehensive and brings more value to the people who go look, who need it. And to me, that has been truly path-breaking, and it's been a great learning. we are seeing that, now data showing a 40% shift in people accessing healthcare, from their homes or from wherever they are. The prediction is that in 5 years from now, 80% shift will happen. So the preliminary interventions, which people had to wait in lines and register and pay and so on and so forth, will change completely, and people will do that. They will be in charge. They will be in control. So when the consumer is in control of what they're doing and what the outcomes can potentially be, then the value sets in. So I think healthcare providers are scrambling, including us, are trying to see how much more value can we bring, how much can outcomes be data driven, how can we measure outcomes by the kind of data which is available now. And I think digitization has given us access to humongous amounts of data, and those who haven't digitized will be left along the wayside. And this data is going to help us in multiple ways. That diagnosis will be AI driven, ML driven, and then it will give the clinician a pathway to really formulate the right diagnosis, which again will bring value to the patients who need it. It will institutions move more and more into research. So I think if that, we're talking, I'm sitting in my office in Chennai, and you're in Dubai, in London, and we're all talking to each other. The same way researchers are talking and exchanging ideas, literally real time with each other. So I think the geographical boundaries have now completely been removed. And with people interacting more for the betterment of humanity, we're seeing that digitization is going to be making the world a better place to live in. Again, the environmental aspects of people not physically, unnecessarily moving when they need to, is then, making it a much safer environment long term for them. So I think hopefully the NCDs, which are diseases which come from, stress and lifestyle, along with genetic issues, will find answers, and people will be able to overcome a lot of it. So we will actually be able to see a drop in the NCDs if we handle it well, if we use data to handle it well. So I'm talking about, access to genetic screening for a large part of our population. I'm talking about lifestyle related diseases, because people have the time to look after themselves, and people have now become more discerning and decided to look after themselves better, that will drop. And so we will look at diabetes, hypertension, cardiac disease, really dropping only because, we've been able to digitize and communicate better. We're looking at the way oncology is changing dramatically. We as a company have invested heavily into oncology, and we're one of the largest providers of high-level oncology services in this part of the world. But we're seeing that with early diagnosis, using digital pathways, that we can actually almost cure the onset of cancer. And we can intervene, and the best in class of immunotherapy or radiation or any of the technology, simply because we can access that kind of knowledge, we can plan treatment pathways, we can have registries which will tell us how the disease is headed, has made a tremendous difference in the way healthcare is being delivered, not only in this part of the world, but because in the developed countries or globally, we're able to learn from each other's just the knowledge which is available. And I think that, to me, again, has made a huge difference. And it is, in a way, a giant leap for mankind.
I'm just going to jump in there, because I think you've shared some really fascinating comments about the use of data and technology and AI, that COVID has actually acted as a catalyst for some of the introductions of these technologies. So I just wanted to jump back to His Excellency and ask, do you think that we're being forced to rush through technological changes in this decade And are there any repercussions that you think we might need to be aware of or consider, given how quickly technology is being introduced into life, whether that's through smart cities, whether that's through healthcare, as Dr. Reddy's talked about in so much detail?
Yeah, I mean, yeah, definitely a great question. If you allow me first just to keep this casual, I'll jump back to the importance of what Dr. Reddy has mentioned, and specifically quoting the giant leap that she had mentioned. I think now we clearly see, obviously, the need for digitization. We see the speed of the growth of technology. But what we're maybe not taking into consideration, the importance of unity to embrace this giant leap. And what I mean by this is in order for technology to work as efficient as it should do, with the high level of improvement of technology in the current times, there should be a giant leap in unity and in inclusiveness and in collaboration at a global level. Technologies at the moment, the scalability of technologies becomes so easy for them to scale up in a snap in comparison to the growth of them in the past. But then with that fast growth, there becomes a major I would say challenge, but I think it's achievable with unity, and it's the data challenge. How much is each and every country and nation and policy willing to give out? What is that thin line between invasion of privacy versus giving data enough for us to create a sustainable digital economy that's beneficial for humanity, as the doctor has mentioned? So those kind of challenges, and if we solve them at a global level in the best way possible, and there are so many dialogues happening at a UN level, at a World Economic Forum level, at the World Government Summit level, so many high-level dialogues between different countries emerging and established. But I think at the end of the day, if we create that alignment on what's right from a data perspective, then this will help the digital economy and the utilization of digitization at its best. If we have that kind of unity, it's easier said than done, obviously, but I think it's the million-dollar question, if you will, that is aligned to the growth of digital economy. Now, if I go back to to the question that you've mentioned, whether we're being forced, and I love this because I can see the question in front of me here, and again, appreciating the level of the software. But by the way, to add a comment here, one major challenge in software when you're interacting is you kind of lose the eye contact with everyone, which is sometimes a major plus when you're having a conversation. But then again, everything else is amazing, and I'm sure this will be something that will be taken into consideration. But going back to the point, are we being forced? I think inevitably there is major risk when there's a major jump, as you've said, a sudden jump into something. Whenever you rush something, you always open doors of vulnerabilities, of risks, and especially when it comes to technology, because one, will the technology fail or succeed? And we all know that the formula in technology, and even in the investors in technology, who are the venture capitalists, also know that they are leveraging on one bet to recover the whole portfolio, because the nature of the growth of technology is usually high risk, high reward. So same thing when it comes to embracing new technologies. Definitely there will be repercussions, but it's how, the biggest question is how can you mitigate that through a flexible, let's say, testing environment. And we are, again, I go back to how fortunate we are with the visionary leaders that we have, who always promote the country as a lab for the world. And when you have that kind of mindset, it means that you are accepting the test. Obviously, as the question states, there are repercussions, but it's how you create that right environment, creating testing zones, whether it's health related, whether it's autonomous mobility related, whether it's blockchain related, AI, machine learning, whatever it is. How can you create that environment to embrace innovation, accept testing, potentially in a confined area, which is something that maybe His Excellency Abdullah bin Togh mentioned in his remarks when he mentioned the Dubai Future District, which is basically a zone driven by testing innovation. And there's so much support given to us from different government entities who also obviously share the same belief, whether it's the DIFC next to us, or whether it's the Dubai SME that supports new ideas as well, or whether it's the Dubai World Trade Center, which is also part of the Dubai Future District. So, so many supporters, but it's how you mitigate the potential repercussions that can come from sudden growth and leverage on the winning ones and pushing them to grow to the max. If we don't do that, then others will lead. And that's the mindset of an entrepreneur that I've mentioned in the beginning in our leaders, pushing us, promoting us, and to come up with new ideas, accepting that some of them might not succeed. But if we don't have that kind of a mindset, we will not be leaders and promoters of the fourth industrial revolution.
Thank you so much. And Dr. Reddy, in the last 1 minute that we have, His Excellency talked about access and inclusion, and with so many economically and socially diverse countries in Asia, how do you think that things can be changed so that people really do have access and are included in digital health services?
I don't think people will not be included in digital health services, and I'd like to give our country as an example. Culturally so diverse, the government launched their the National Health Digital Mission just about a month ago, but it took 6 months of planning. I think they accelerated it during the lockdown. But what it will provide is that, in the first phase, it will cover at least 30% of our population. You finish, the first plot, then the next round will be much, much easier. And I see that happening. So to me, that is for a country like ours, which, the health is not even a central subject, it's a state subject. It is so diverse. And here we've had the courage to really launch a digital health mission. So I think to me that was very path-breaking, totally path-breaking. His Excellency spoke about, unity, collaboration at a global level. Don't do that. I think humanity at large will lose. Because, we're talking about the vaccines, and we know at some point the vaccine will come out. But unless we're able to test it in multiple ethnic populations, we do not know what the outcomes are going to be. And if the outcome data is not globally used, utilized, shared, then we're talking about repercussions. So I think, we as leadership, we who, can make a difference in policy level in our countries, we should be able to say that, at a level where we're really making a difference, where it is life-threatening or where it's a global challenge, there must be unity, there must be collaboration. A high level of testing, I think, is required, and, he did mention that. And data transfer has to be seamless, but it has to be ethical. And I think, we need to find solutions for that, where data will be used in an extremely ethical fashion, and that the outcomes will really impact positively what we're doing. So are we in a rush to embrace technology? I feel, it's life or death. So honestly, we are in a rush to embrace digitization. The repercussions, some will be there, but are we quick enough to adapt and learn from the repercussions so that it's not a disaster? Is probably the lesson which is for all of us to embrace and learn.
Thank you so much, Dr. Reddy. I think you've left us with the perfect thing to think about repercussions. I wish we could stay talking to you and His Excellency for much longer, but sadly I have to end the session. So thank you both so much for sharing your fascinating insights and thoughts with us. Thank you for attending. Please do not forget to visit the Partner Expo, which hosts ABLF's own booth where you can watch past videos, browse through the magazine, the ABLF Times, or even view past telecasts. If you did miss the beginning of the session, you are able to watch it back after today, so please do that. The ABLF partners are Etisalat and Vicky, and the ABLF media partners are CNBC Arabia and Entrepreneur Me. So thank you so much to all of you for your support. I will be moving on to the Zayed Congress Centre now for the Future of Mobility session, so I'd love to see you there if you're interested.